Did you know there is a connection between music and medicine? Dr. Travis and Dr. Freda Lewis-Hall, the Chief Patient Officer of Pfizer, are in Nashville, the music capital of the world, to check it out.
My name is Erin, and 2 years ago, my son Donnell began having seizures. Medications weren't able to control his seizures, and he had to give up playing sports, which he loved. He was referred here to Children's Hospital at Vanderbilt, where he underwent brain mapping. First, they shaved his head, then they inserted probes into his brain to see exactly where the seizures were occurring. Donnell began to get very depressed because he had been here for a little over 2 weeks, and he knew he had to come back for another surgery. So the hospital had him meet with Dana, who is one of their music therapists.
Music therapy goes beyond just listening to a song. Board-certified music therapists are trained to assess, create treatment plans, and evaluate patient progress utilizing individualized music interventions. We often involve the entire family in our treatment process, which can improve patient outcomes. We use our music interventions to reach a wide variety of goal areas here in the hospital, so that can be managing chronic pain, physical rehabilitation, psychiatric symptoms, as well as providing procedural support at end of life, as well as just helping our patients and families cope with being in the hospital. During my assessment with Donnell, I learned he likes rap music. So through writing and recording a rap and creating a music video, we were able to help him express complex emotions, identify coping tools, and connect with his healthcare team in a really humanizing way.
Writing about what was happening to me made going through it a lot easier to deal with. The rap took my mind off of my procedure. My whole family and nurse got involved in it. Writing, recording, and making that rap video was fun. It made me feel good to rap about my life. When I come back, I want to broadcast my video for all the patients to see it.
So Dr. Freda, what a great kid. People may think music therapy in kids makes sense, but pediatrics, it's just the beginning when it comes to music therapy, which is such a great thing because music therapy can also help people who are recovering from a stroke or traumatic brain injury that has damaged the brain region responsible for speech.
And some people can actually regain speech by singing a song that they recall by melody. Because the lyrics are attached to the tune, it's almost like a key to getting words back. It's really fascinating. And also in some cases, music and music therapy have been shown to help reduce stress and anxiety, to help aid in easing pain, and even in some cases, to help alleviate nausea in patients who are receiving chemotherapy.
Music and other sounds, they enter the ear as sound waves. That creates vibrations in our eardrum. They're then transformed into electrical signals, which travel up the auditory nerve to the brain. The brain then interprets those signals into something we recognize and understand in many cases, of course.
And you know, Dr. Travis, music affects more than the areas of the brain that process sound. Scientists have found that when music stimulates the brain, it shows up in areas that are involved in emotion, in memory, and in physical movement. And when you're dancing or moving to music, that is associated with decreases in anxiety, depression, anger, and stress.
Music therapy can also improve the quality of life for patients suffering from dementia. It can help them recall memories. It can improve physical coordination. It may even reduce agitation. And this is something I think is so great. They may be able to tap to a beat that they remember. Maybe it's a song from their childhood. And they may not even recognize the loved one, but they'll recognize that song. And that's a way for family members to connect with someone who's maybe in the later stages, maybe even someone who has difficulty with verbal communication.
You know, managing health conditions can really go beyond taking your medication and making your appointments. These are all very important, of course, but sometimes better function and better health can be found in very unexpected places, like your favorite song, for example. So there's lots to know about music and its effects on your health, and to learn more about that, people can go to gethealthystayhealthy.com, and of course, while they're there, they can sign up for our monthly newsletter.
In medicine, quality of life is so very important. Dr. Freda, thanks for being here in Nashville with me. Dr. Ordon, take it away, back to you.
See you soon, Dr. Travis. We miss you, and stay tuned. Lots more to come.